Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, March 2nd, and this is our COVID briefing. We have had 8,215 cumulative positive cases of COVID-19 in Missoula County to date, with 18 new cases since yesterday. We've had 82 deaths associated with COVID-19. We currently have 101 active COVID-19 cases, and we have 2 Missoula County residents and 6 out-of-county residents currently hospitalized in Missoula County. Our average incidence per 100,000 people is now down to 13. The state of Montana is reporting 100,158 cumulative COVID cases, which is up 165 new cases since yesterday. There are now 1,587 active cases with 83 active hospitalizations across the state, and there have been 1,372 deaths related to COVID-19 statewide. The University of Montana has had 669 cumulative UM-associated cases since the beginning of fall semester back in August, with 2 new cases reported since yesterday, and there are currently 11 active UM-associated cases. To date, there have been 29,566 doses of COVID vaccine administered in Missoula County, with 11,319 people having received both the first and second dose of vaccine. We continue to get around 1,500 doses of vaccine per week, but we expect that we will begin to see an increase as the new Johnson & Johnson vaccine received emergency use authorization and will begin shipping across the country this week. So today marks 1 year exactly since we at the health department organized into the incident command system in order to respond to the then impending COVID pandemic. We've all seen many changes over the past year to our everyday lives, but at least now we're beginning to see an increase in the amount of vaccine becoming available, and hopefully that will mean that the end of the pandemic is on the horizon, while I still think it is probably going to be several months out. Today, I'm going to talk about vaccine, the tiers used for prioritizing vaccine, when we think we might be opening up to phase 1B and what that might look like, and second doses of vaccine, and a little bit about variants. First, I just want to say that if you qualify for a vaccination, don't hesitate to get signed up for an appointment. You're not only helping yourself, but you also help the community as a whole when you get vaccinated. Don't be bashful if you feel like you shouldn't qualify because maybe you feel like you're really healthy for your age or you have another type of hesitation. There will be enough vaccine for everyone in the coming months, and vaccination will go much more smoothly if everyone gets vaccinated when it's actually their turn rather than waiting. Next, I want to talk about phase 1B tier 2 vaccinations. We continue to monitor the number of people who qualify under phase 1B tier 1 and compare it to those who qualify under that tier and expect to be able to open up tier 2 in the next few weeks. We're working on protocols in order to properly screen individuals with qualifying health conditions for when we do open tier 2. We don't have an exact date yet, but we do expect that it will be mid to late March. So continue to check our Facebook page. You can keep an eye on the website at covid19.missoula.co and missoulainfo.com for announcements. Lots of folks who have had cancer previously are wondering if they will qualify in phase 1B tier 2, and the answer to that is yes. Anyone with a history of cancer, whether it is in remission or not, and no matter what type of cancer that they had, will qualify in that phase 1B tier 2. Johnson & Johnson will begin being allocated to Missoula County starting next week, and I just want to let you know that in its phase 3 trial, Johnson & Johnson was 100% effective at preventing hospitalization and death due to COVID-19. It is the only single dose COVID vaccine approved right now. So if you get scheduled for a Johnson & Johnson vaccine appointment, you will not actually have to get a second dose appointment. You'll be totally covered with just that first dose. There are some misconceptions about the Johnson & Johnson efficacy rate. In some reports, its efficacy rate may appear lower than Pfizer and Moderna, and this is because the Johnson & Johnson vaccine was tested against variants and tested globally, while the other 2 available vaccines were not. Johnson & Johnson is highly effective at preventing hospitalization and death, and we just want to encourage you to take whatever brand of COVID vaccine you are able to get, as they are all similarly effective at preventing the transmission of the strain of COVID circulating here, and more importantly, they're all very effective at preventing severe disease and death. I want to talk again about the second doses of vaccine. If you got your first dose at our Lucky's Market site with Pfizer or Moderna, your second dose will be 21 or 28 days later at the exact same time as your first appointment. You will get a phone call from the health department just to remind you of that appointment in the couple of days before that second dose appointment. We are not rescheduling any appointments except for on a case-by-case basis for patients who are experiencing a serious emergency. Getting your second dose should be a top priority. We have hundreds of patients booked each day on a very precise schedule that helps keep everyone socially distanced. And so rescheduling an appointment is incredibly difficult for us to do. Also, just a reminder that you cannot get any sort of vaccine 2 weeks before or after the COVID vaccine is administered to you. So please hold off on your shingles vaccine, flu shots, or any other vaccines that you're considering if you have plans to get a COVID-19 vaccine in the foreseeable future. It's just better to hold off on those other vaccines just so it doesn't interfere with that COVID vaccine. Last, I just want to let you know that no COVID variants have been detected in Montana so far. The labs are testing random samples for the variants, but they haven't popped up here yet. I also want you to just keep in mind that wearing a mask, washing your hands, social distancing, and keeping your social circles small are still incredibly important. While our numbers are remaining low, we do still have COVID circulating in our community, and we want to keep those case counts low and manageable. There's no sense in losing the progress that we've made so far. So let's all keep up the good work and keep using those prevention measures until we can get through to the end of the pandemic. So that's all I have for you today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department Facebook page. You can call 258-INFO if you have questions about what vaccine clinics might be available, if you have general questions about COVID-19, if you are having any symptoms and you would like to get scheduled for a COVID test out at our Flynn Lane drive-through testing facility, or if you want to know what resources might be available to you in the community. You can also check out our website at missoulainfo.com. We post all of our data there, so all the numbers that I talked about today, as well as their corresponding graphs and lots of other information and FAQs on COVID-19 and the vaccine. So until Thursday, everybody, stay healthy.